a respecialization, which is like another doctorate in clinical psychology. I serve a lot of kids with autism, TBI, and mood disorders. So needing to learn more and better about how the brain operates. And so ended up doing more neuropsych testing, which is really just a big fat way of saying I'm a nerd. I love what I do, and that I have student loans that I'll be paying on from now till forever.
Oh, thank you so much.
Sure.
So everyone, just so you understand, this workshop is being recorded. However, we'll end the recording when we're doing our question and answer period with Dr. Tag. I'm also going to set up a poll. If everyone can take their time, a moment, and answer the questions. There are multiple questions on the poll, actually 3 to be exact. If everyone could take a moment and fill that out, that would be great. Hi, Anissa, welcome. I just set up a poll. If you could take a few moments and complete the 3 questions, that would be great.
Where is the poll at?
Oh gosh, I forgot to hit launch.
Oh, you know what? It just popped up. Yep.
Yep, there you go. Yeah, so if everyone can take a moment and fill out that poll, that would be great. There's a total of 3 questions. Then we'll also be doing a poll at the end of the evening. Great, I'll give it a few more moments.
Hello.
Hello.
Yeah, actually, I'm just seeing the poll results.
Oh, the poll ended. I apologize.
Oh, okay. I was just about to do it, and then the results popped up.
Oh, I'm sorry. I'm so sorry.
It's
But
fine.
there'll be another poll at the end of the session.
Okay, it's fine. Thank you.
So thank you so much for taking the time. Dr. Tag is going to screen share and share her presentation. We'll have that available for any parents who are interested. All you have to do is email Lisa Johnson. She'll put her email address in the chat box, and you can email her directly for a copy of that when it becomes available. Thank you. And without any further ado, Dr. Tag.
Wonderful. Well, I am so appreciative. Well, let me first stop and make sure everybody can see the understanding evaluation slide. Get a thumbs up or a yes in the chat. Everybody can see it. Okay, thank you, Lisa. I appreciate that. So I am Dr. Becca Tag. Most folks really call me Dr. Becca. My dad's a veterinarian, and so whenever I hear Dr. Tag, I like look around for, I don't know, a doctorier doctor than me. I think working with kids, Dr. Becca sounds more human. My hair's purple and shaved, and they often say, when's the real doctor getting here? And I'm like, well, I'm it. So what do you want to do? So I'm a licensed psychologist, a nationally certified school psychologist, and a BCBA, so board certified behavior analyst. And this other set of letters is just clinical psychopharmacology. So I have prescriptive privilege where that's permitted. I want to start by saying a big thank you to the ARC of Philadelphia for the opportunity to come and talk with you all about understanding educational evaluations and eligibility evaluations. Sometimes it can be confusing, and I went to school for a really long time for this, and it can still be confusing. So I want to acknowledge and normalize any confusion or uncertainty that you might have, and to really remind you that this space is set aside for you. So if you have questions, pop them in the chat box. You can ask them in whatever way feels comfortable for you, because by choosing to spend the time here participating in this webinar, you are not doing a million of the other things that need your attention, from, you know, cleaning up to laundry, dishes, eating, scrolling on TikTok or Instagram, right? All of these other things that are activities that we often engage in. And so I want to be sure that you're getting what you came here for. So please feel free to ask a question. There's no question too small, too big. If I don't know the answer, I am committed to helping you find that information and follow up. So again, I'm a psychologist. I own a multi-specialty practice here in Southeastern North Carolina, Del Mar Center for Behavioral Health. And we also have a private school, Del Mar Day Academy, that serves individuals with autism and related disabilities. So I think starting by just talking about what is an evaluation. An evaluation, first and foremost, is a process. It's not a one and done. It's a variety of steps and activities. And in this context, we're talking about a process that helps parents as well as the school district, or the LEA, right, local education agency, the district, the school team, determine if a child has a disability that impacts learning, and what services or what type of supports that child may benefit from. Evaluations aren't only used in this context. As a psychologist, I do evaluations for military personnel or police officers for fitness, you know, to see if they are eligible to work in certain positions. Or I took an evaluation to become a licensed psychologist or a board certified behavior analyst. And so evaluations occur all over, and it's really looking at the skills that an individual has and comparing it to the skills expected or needed. And then in this case, also looking at what type of supports might be helpful for that individual to be successful. Oh, I do see a hand is raised, and I'm not sure if that's intentional. So Lisa, if you have a question, please feel free to ask it. And if not, use the chat box, you know, truly whatever feels comfortable for you. It's okay if you interrupt me. It's not going to be the first or last time in my life that that's happened. So please, I want this to be useful for everyone. So there's a couple ways to sort of start this process. Remember, an evaluation is a process. It's really important to remember that. And so there's a couple ways to start that. If we're talking about an educational evaluation, you can put your request in writing to the school, and then in general, the school needs to respond within 10 days with either, so this is Pennsylvania language, so if you move to a different state, there'll be different acronyms, but PTE, permission to evaluate, or PTRE, which is permission to reevaluate. Because an evaluation cannot occur without your consent, mostly. And so you need to be part of that process, and the school can't lollygag, which is why you want to make the request in writing. Email can be a great way to do it because it's date and time stamped. And then again, they need to respond within these 10 days. I have a sample one. This just came from the internet. I'm sure there's lots of other ones, but sometimes parents worry that they're going to say the wrong thing, or they're not sure what to say. There's almost no wrong thing to say. You're reaching out, the principal or the special ed administrator. Sometimes I copied the school psych on it. It really depends. And then, dear so-and-so, I'm writing to request that my child be evaluated for special education services. You can say things like, I'm worried that he or she or they is not doing well in school or may need supports. Label the grade, the teacher. You can say specifics that you're worried about if you'd like. You can also list things that the school district has done or things that you've done to try to help your child close that gap or be successful. You also don't have to do that, but I find that when you write it in this letter, there's less follow-up questions and things don't delay quite as much. And then you just sign it and send it in. The other piece is I put this little note on the bottom. Now, if your child has been evaluated outside of school and received an evaluation by a psychologist or a physician, then you would sort of put this in here and say, you know, so-and-so has been identified as having a disability by professionals outside the school system. And you can label who it is and enclose that evaluation report should you choose to do so. And because we're talking about evaluations, and we are going to talk mostly about evals through the district, it is important to know that that's not your only option. So you can get an evaluation through your health insurance or, you know, really health insurance, or through a child study center at a university. There's other ways to get an evaluation, and then you can share that information with the district. And for school age kids, really 3 and up, you can go right to the district at no charge and make a request, and they need to respond. Any questions about making this this request for an assessment or an evaluation? It can also occur within the school district if the school initiates the process of evaluation. The school can do this, but they must have your permission. So either you can initiate to the school and say, you know, I'm worried about my son or daughter, and I'd like to get an evaluation to determine if they would benefit from specially designed instruction, or the district might initiate that process. If they initiate it, again, that PTE, or that permission to evaluate, must come home for your signature. There's very few cases, but it can happen that if you don't agree and the school still believes it's necessary, they can seek out due process, which is a legal proceeding, and have like an impartial hearing officer review the case and give that consent potentially. That happens very rarely. However, it is, you know, still an option. In general, I find that parents are either making the request, or the schools are noticing that a child's having difficulty being successful and reaches out to the parent, whether for conferences, they're trying things in the classroom. If you're part of an MTSS district, multi-tiered system of support, that used to be called RTI, response to intervention, it's got a million names, but needing to kind of look at that collaboration. So a great question that came in that says, do we still have to do it even if our child is evaluated from outside? Yes, that's a great question. So if your child, let's say I'm a licensed psychologist in private practice, and you bring your child to me because you're concerned about autism symptoms, I would do an evaluation, a psychodiagnostic evaluation, and provide you with a testing report. And let's say we determined that based on the information and data collected that your child does meet criteria for ASD, or autism spectrum disorder. Generally the first, well, maybe not the first, maybe I make it last, but one of my recommendations is parents may choose to share this report with so-and-so's educational team to determine how this information may impact service provision in the educational setting, which basically means that I would encourage you to share it with the district. However, I can't do that for you. It has to be done, unless with a signed consent to release, I could send it over. But yes, the report would need to be provided to the district. And then, and we'll talk about this later, but an outside evaluation, so a medical evaluation, is different than an educational classification. So as a psychologist, I diagnose. When I was working as a school psychologist, you cannot diagnose. You're participating in classification. So even if there's an outside evaluation, it still has to be brought to the district and almost translated into education language. So I speak Spanish and English, right? So it's almost like I have this evaluation that's in one language, and then I have to translate it into another language, because there's almost different language between medical and school. And we'll definitely keep talking about that. So I love that question. Let me know if I didn't answer that clearly, and let's circle back and keep talking about that, because really there are two pathways towards special education services for school age kids: this outside evaluation and the educational. I do recommend they don't occur at the same time, and here's why. Because I can only give, let's say I'm doing an autism evaluation. There's tests that can only be given once every 12 months. Most tests can only be given once every 12 months. And if I don't know the district's also giving it and I give it, it actually can invalidate the whole thing. And then we've got to start back over. And measures are expensive, and sometimes folks don't have extra measures. So if you are going to go through, I generally say pick one process first, and then you can fill in the gaps. So if there's an educational evaluation and you want more info, I could fill that in. Or if I do a medical one and they have to add in extra, they can do that. But doing them at the same time runs the risk of invalidating the whole thing because of the guidance that we have for certain measures. Really good question. Thank you. I also have 2 pugs. So if you hear a sound that sounds like, I don't know, a lumberjack snoring, that's just what pugs sound like. And it's the soundtrack of my life. And I don't often notice it anymore until I realize other people are probably hearing it. Another good question came in. So should we request certain evaluations or let the evaluators choose them? That's an excellent question. And we are going to talk about that next. So we couldn't have planned that any better. But what you're talking about here is designing the evaluation. And remember, an evaluation is a process. It's not a one and done, right? It's like a ongoing process, because a snapshot of one skill or one moment in time does not give you anything other than one snapshot. So I have multiple sclerosis, and some days I have more symptoms than others. So if you take a snapshot of me on that day and then you generalize that to that's how I am every day, you're going to miss some information. It's the same for our kids, that there is we want to get data of them across time, across environments, right, across these different states, so that we can get a good picture, because a disability does not occur in one setting. It doesn't. It occurs across settings. And so really we're looking for that pervasive nature. So it's a process, the evaluation process in Pennsylvania. So remember, there's some state specific stuff. And in Pennsylvania, it cannot take longer than 60 calendar days. And summer is not included, from when they receive your permission. So do you remember back here, this PTE and PTRE? Really, we're going to talk about the PTE, that permission to evaluate. There's 60 days from after when and it's calendar days. Some states are school days. And it's calendar days from when they receive that to when it needs to be completed. So really, I think of this law as protection for our families. And it's really holding accountable the districts, and not because the districts aren't lovely, but because they're big, right? And so these make sure that you are getting the information that's best in a timely manner to help your child be successful. There's going to be a variety of different assessments, and the components of that evaluation, just like that question. So the evaluators should be able to select them. You can give input, but unless you know a ton about psychometrics and test and measures, I think it's good to let them pick what they think is best, because they are the experts. And sometimes we've had a rocky road leading up to that point. We want to go in there like guns blazing and making sure that we're getting everything that we're asking for, but we may not even know. And so I think it's good to in most cases, the way they're written is an individually administered test of cognitive assessment, right? So that's an IQ test, it's often called. But I don't specify which one, because for a few reasons. One, I might have one idea, and then I get in there with the child and I'm like, oh shit, this is not, I need to try something different. But if I have a specific one, like the WISC-5 is a commonly used one. So if I write that on that PTE, on that evaluation design, and that's what you signed off on, I can only do that. And so it actually sort of ties my hands and can delay the process, because then if I want to give another measure, I have to go back and make sure that it's okay with you that I administer this other one. So I think it's important for parents to be involved so that you know what kinds of measures you should be seeing, and who should be doing them, right? So there should be a licensed psychologist, or in Pennsylvania, I think they're called certified psychologists, school psychologists, should be involved in this. If there's a speech language evaluation, it needs to be an SLP, not an SLPA. So districts do this sometimes where there's a speech language pathology assistant. Generally, they are allowed to deliver services, but they should not be doing the assessments. So you want to be sure that it's an SLP doing the assessment or evaluation. Same for OTs. You want an OT or occupational therapist to be doing the evaluation, not a CODA, which is an OT assistant. They're lovely for implementing intervention, but those evaluations really need to be by those independently licensed or certified individuals. There's also guidance, and I looked for it in Pennsylvania and didn't see it, but we have it in North Carolina where it says very clearly what must be included in every disability category. So for autism, so for an intellectual disability, there has to be a cognitive measure, there has to be a Vineland or an adaptive behavior measure, there has to be a hearing and vision screen, you have to rule out lack of exposure to instructions. So there's these lists of what needs to be included, and I think making sure that the team, the school team, is completing this documentation with you involved and they're explaining it to you is a great way for you to guide that evaluation. Sometimes, having been in a million IEP meetings, not that it's okay, but I've seen it where this IEP meeting becomes just such a, or even any sort of school meeting becomes just another meeting, and people can be moving so quickly through it that I want to really empower and encourage you to ask them to slow down and explain that to me. And, oh, I see you writing on that evaluation design. I'm not really sure what that is. Can you explain it to me? They don't do it to be, there's no malintent. I have to assume that, right? I have to assume that people get into helping kids to help kids. It's that they forget that this may be your first meeting, or this is your one meeting a year when maybe they've got 5 a day. And so I really want to encourage, one of the greatest ways you can guide those assessments is really asking for clarification, asking what they're writing, asking who will be doing it. So you don't necessarily need to see the name of the test. In some situations you may need to, but not really. You need to see who's administering it. So making sure it's the SLP. So like they wouldn't put my name, they'd put school psychologist, right? Or outside psychologist or behavior analyst, because things change. And so what if I'm no longer at that school? So it's got to be specific enough to yield good, accurate information that we can make decisions from, but not so specific that it actually traps us if we learn some data and we need to be flexible and make a change. I see some really good questions kind of coming in. A list of possible evaluations or assessments. So I think that's a great question. And there's not totally, only because new evaluations are coming out all the time. But also there's so many different things that we could be testing for that I'm just not sure that a list would be helpful. But what I hear there is worry that you may not be getting something that you need. And I think that open conversation with the school team can be helpful, utilizing advocates, right? Folks who do sit in these meetings a ton. If your child is getting outside services, you can always ask them to take a look at what's being designed. So a big one that I see is speech language therapist. So if you're doing a ASD eval, right, and they'll say a speech and language evaluation, one of the things that I would be sure to see on there is to include pragmatics. I'm going to say that again, and I'm actually going to type it in the chat. To include pragmatics. And pragmatics is the social language, right? And that doesn't have to technically be included in a speech language evaluation. And you might be thinking, well, oh my gosh, Dr. Becca, that's a key component of autism. Why would we not do it? I don't know, because systematically we're still trying to catch up with the time. So again, if you're getting these outside services, let's say your child's getting outside speech, you might check in with a person. I also, gosh, I have been amazed at the support that folks get on social media groups And even in things like this, where families are coming together and sharing that knowledge, so checking in with other folks, you do have to sign and return it, but you don't have to rush. Take 24 hours to look it over. Call the ARC, call an outside provider. I get calls from families that say, hey, can you take a look at this eval design? Does this look like something, is there anything missing? I actually don't charge for that. I mean, I think reach out to your community, because there are folks there that can help. And sometimes we think we have to sign it right away because we just want to get moving. But sometimes just pausing, right? Hit that pause for 24 hours, review it. You're going to be one day behind. I mean, and not even behind, right? Because more isn't better. Better is better. And that pause button might really help you review and get input that make sure it's a good eval, right? Measurement is how I know I'm a nerd, right? So measurement is all about the tools that you use. If I go outside and I want to look at the moon, I shouldn't grab a magnifying glass, right? I need a telescope. And the telescope versus the magnifying glass versus my contacts is these measure selection. And so we want to select the right measures. And we need to create space for the professionals to do that, while also making sure that we are part of informed consent, is knowing what is happening with your child. To assess pragmatics, there's a variety of different measures. So there's a lot of standardized measures. It's also harder to standardize, but generally by 5. Sort of 3 and 4, it's harder to tell. You can tell somewhat, but remember, in order to identify a gap in skills, there has to be enough skill expected that there's something to measure. And little guys and gals don't have a ton of that. Pragmatics is it's social language. So maybe you've seen a kiddo like this. They've got an excellent vocabulary. There's actually a wonderful research article. It's like, I can name all the planets in the solar system between here and the next one, but I can't tie my shoes, right? It's like they've got all this knowledge, but they're missing some of the day-to-day knowledge. They maybe stand too close. I'm Italian and Puerto Rican, right? So I'm using my hands. That's actually pragmatics. It's the integration of nonverbal and verbal skills. And so that is not going to be picked up in another assessment. I think I'm missing some questions here. Turning 3, having an IEP, maybe the same type of testing. Yep. So we will definitely be talking about reevaluations here coming up in a little bit. Sorry, I'm having a hard time kind of scrolling. Oh, there we go. That's on me. Pragmatics, OT, speech and behavior specialist. He's in preschool transitioning 22, 23. We'll discuss testing IEP service. Like, yep. Yep. So there's some questions here about transitions, which are often anxiety provoking for families, because it often happens right when you've hit a sweet spot. Even if you're not totally happy with how things are going, you know what to expect, and a change can be really scary. So I want to normalize that. And yes, this is another example of empowering families to ask questions and be involved in the process, and saying things like, when can, not will we be having a meeting, when can I expect that transition meeting? I've been watching my email inbox for that transition meeting invite. I've not seen it come through. When do you all typically plan those? It's just like we do with our kids, right? If I say, are you ready to do math? And they say no, well, then I just let no be an answer. It's, well, I've been looking for that. When will that occur, right? It's not an option. When will that occur? Because I'm ready, And so I think in a kind and compassionate, but also firm way. So whether we're talking about transitions from preschool to school age services, whether we're talking about that sort of age 14, which is that traditional transition age when students are involved in planning for the transition out of school, even changing from year to year, from school to school, I think that is a very valuable question. And I don't know that that's for an IEP meeting necessarily. You certainly could. I would ask for a transition meeting at the end of the year, and then maybe another one 6 to 9 weeks into the first year, because into the next school year, because the teacher's got to have time to get to know the child, and relationship matters. And so that sort of depends there. To give parents so they can adequately assess tests and evaluations. Well, so I think that's a great question. And I think, I don't know. other than going to school for them. I mean, there's some things that we can talk about as far as a good assessment later, but I don't want you to get caught up in thinking that you need to double check the work of your school teams, because that really defeats the purpose of needing to call on them to do their job as professionals. But we will talk about some different ways to identify quality assessment, and then how would I know the results are complete or accurate. I think we have to trust that these are professionals that are operating under codes of ethics, and that they got into these fields to help children. Now, if you get the results and you totally disagree, yeah, I mean, let's chop that up. Let's talk about it. Could it be the measure? Do we need an IEE, which we will talk about? Or is it even that we've had such a poor experience so far that I'm finding it really hard to trust the team, period. And I want to validate that too, because that happens. And the only way through is through. So in those situations, we kind of get to decide, either I'm going to hire somebody else to comb through everything that they're doing, or I want to try to give this a chance to be different. And only each of us knows our own situation. But I think that expectation on self of needing to double check all of their work, that's a lot. And I do believe that, now I don't always believe in all of the, bureaucracy is the right word, but the systematic rules. I do know school psychologists, I do know SLPs, I do know OTs, I do know they get into this to help kids. And so really, even if you don't trust the system as a whole, can we connect with one or two of those professionals? So again, in the evaluation, because it's a process, there's going to be a variety of measures, which we're going to talk about. And then the different measures selected are also going to be different because of what category are we looking at. So if we're looking at ASD, pragmatics might be extra important. If we're looking at ID, or intellectual disability, which is what used to be called MR, or mental retardation, we may not look at that. It may not be valid or relevant. And so really looking at what are the criteria that need to be met for the disability category, and then making sure that we are checking the boxes in that category. There should be a variety of different professionals, so speech paths, OT, occupational therapy, physical therapist, psychologist, maybe a nurse, the teacher, and don't forget you. Gosh, don't forget you. And these are set forth by IDEA, and a part of that is IDEA determines who needs to administer certain measures, so does state law. But also the IDEA also determines who needs to be at different meetings to report those results and to represent the different professionals. So some of this is set forth by IDEA, and some is set forth by each individual school team as far as who specifically, and some of it's set forth by you. There also could be, so like the nurse oftentimes does the hearing and vision screen. If you are looking at, let me see my next slide, because I don't want to duplicate myself. If we are looking at, yeah, I won't go too far. But don't undervalue your input. Truly, I think I say a million times a week at least that I may know psychology and ABA. You are the expert on your child. Don't undervalue that. There's things that you know and that you see that, let's say it took you a year to learn. You don't have a year to learn that. I want to know that from you so that we can jump in and hit the ground running as much as possible. And that you really know your child. They're the most comfortable with you, which means you get sometimes the best and the most challenging behavior. But to really own that, sometimes, again, in those IEP meetings or those meetings, it can feel like everybody knows so much more, and they're using these acronyms, and they're talking about decoding and oral reading fluency and all of these things. I gotta be honest, that stuff all is second to the human in front of us, which is your child. We'll get to that stuff. Let the teachers and the school staff focus on those things. You bring those questions, or you bring that really robust information about your child to the meeting, because that helps to drive the evaluation design. So if a child struggles with a learning or with speech and language, and I'm going to select a cognitive measure, an IQ test, I'm going to pick one that has a nonverbal and verbal component to it, so that I can compare the impact that language might be having for the child. If I don't know that, I might pick remember, I'm outside with that magnifying glass looking at the moon. So really, you've got lots of great information, and that's why it's a multidisciplinary team. We really have to hear from everyone. Okay. So that permission to test or reevaluate, permission to evaluate, permission to reevaluate. Again, this is Pennsylvania specific language. So if you go somewhere else, you're not going to see it. Each state has their own language, but it should clearly state what components will be included in the evaluation and by who. Remember, it may not say the WISC-5 for a cognitive measure, but it should say an individually administered test of cognition, right? An individually administered test of achievement. That makes sure that it's not in a group and that it's being administered in a one-on-one setting. It won't necessarily say by Dr. Becca, but it will say by a school psychologist, or school psychologists don't often do the ADOS or some of the autism testing. And so the district may bring somebody from the outside in with special training for that, or with an FBA, right, a functional behavior assessment. So there are other options. It may not list the person's name, but it should list their qualifications, right? It needs to be a licensed psychologist, a licensed speech language pathologist. So there's going to be different types of assessments within the evaluation. There should be a hearing and vision screen. I've been in glasses since, I don't know, I think I needed to wear them in kindergarten, but I just didn't. And then I started not doing well. And then I actually had to start wearing them in 3rd grade. I think my teachers thought I wasn't very bright, and really I just couldn't see the board. And I didn't know that people could see better than I mean, I thought everybody saw what I saw. I will never forget putting on a pair of glasses, actually I think it was contacts, for the first time, and being like, oh my God, this is like a whole new world. And I can only assume that it's because my teacher reached out to my mom and was like, I think Becca's not doing so well. I think she's brighter than this. It's not a disability. I mean, it is not something that I needed an IEP for. So we need to rule out those hearing and vision screen. A cognitive assessment, that's that IQ test, and that's often called an individually administered test of cognitive skills or cognition. Academic and achievement testing, that's an individually administered test of achievement. There's a bunch of them. We want to empower the psychologist to pick the one that's the best fit for them, based on what the district has and what the child needs. And districts can't, so you can't use outdated tests, but that's a law. And so I really don't see that much. I mean, we want to trust but verify, right? And so I think it's important to know what's happening, while also we do need to be able to hand some of that trust over to the professionals. So that we can hear from them what they're doing and trust that they are wanting the best for our child. Rating scales, these are things like the Vineland 3 is an adaptive behavior scale. We do it electronically. I don't know, I think schools some might use paper, I'm not sure, but it's going to ask you a whole bunch of questions about always, sometimes, never, or often does your child do something. And it can be self-help skills, like daily skills, like brushing their teeth, dressing themselves, toileting, to initiating appropriate interactions with peers. There's also something called the BASC, a behavior assessment system for children, that is like really in almost every evaluation, because it casts out this huge net and kind of looks at all kinds of stuff that could come up. There should be a variety of rating scales, right? Where it's not a one and done. We're looking for multiple data points, while also not wanting to inundate you with 100 things to fill out. Again, rating scales can be specific. So if we're looking at autism, we need to have rating scales that are specific to the criteria of autism. So RRBs, those restricted and repetitive behaviors, there needs to be a measure that looks at that. There needs to be a measure that looks at social interaction and communication skills, whereas those may not be as important for an intellectual disability. It might be, I don't know, but we got to look at that. And so those rating scales should be selected based on the symptoms and behaviors that are seen for your child and the suspected category of disability that we're looking at. There's also behavior assessment. So those could be things sort of like that BASC that I mentioned. It's a behavior rating scale, but also there's things where you, so like the ADOS is one of them, Autism Diagnostic Observation Schedule. And it's really setting the child up in certain situations for them to have a difficult time with certain things. It's not tearful or anything, but it's creating these social environments where either the child struggles or is successful, because our kids are often pretty good at masking, right? Avoiding things that they're not good at. Me too, PS. Let me not pathologize that. Me too. Like, there's a lot I'm not good at, and I kind of avoid it. So in order to look for a diagnosis, we really need to elicit or create those environments. There's also behavior assessments, like I mentioned, an FBA or a functional behavior assessment that could be part of an evaluation. If that box on an IEP is ever checked that says behavior impedes learning, I would really push for an FBA and make sure that you've got an FBA. The name of the autism checklist. Oh, so perfect. Let me type this in the chat. So it's BASC, Bravo Alpha, the BASC, and then the other one is the ADOS. It's actually the ADOS 2. A lot of districts don't give this measure, some do, but remember, districts cannot diagnose, and so they're looking to classify. So just because you don't see that, I wouldn't automatically assume it's not a good eval for ASD. It's great if your district does it, but not necessarily. Okay, so physician input. You might be wondering, well, why the heck is this on here? Well, for some of them, like OHI or other health impairment, there needs to be a diagnosis that has to come from outside of the school. So ADHD often falls under there. So ADHD can either be inattentive type, hyperactivity type, or combined type, which basically means a mixture of the two. That diagnosis cannot come from within the school. The school cannot make any diagnosis, let alone autism or specifically ADHD. So a licensed psychologist or a physician can make a diagnosis of ADHD. Then you would take that to the district, and then they would take that information into the evaluation for OHI or other health impairment. So again, specific measures should be selected in the different categories based on each child's profile. And the profile is the things that they're doing really well, because let's not only focus on impairments, we also want to look at strengths, glows and grows, right? Both are important. We also want to select measures based on what the disability category is that we're looking at for each child. So it really should be individualized. There's going to be some standard operating procedures, but again, the flexibility in making selection of measures should come into account. I will say districts often have less options than an outside evaluation. So like when I was working in the school district, there was sort of a couple measures we could pick from in these different categories. And in private practice, I have a variety that I can pick from. So it doesn't mean that one is better or worse. It means, again, that schools are really looking at classification, while private practice or medical is really making a diagnosis. So when we think about a reeval, initial evaluations cannot be done with just a record review. I mean, I think if that's recommended, I would really say no. And I very rarely, without knowing your child, or I would very rarely make those recommendations. And an initial evaluation really needs to have some testing to go with it. It's just too important. Now, reevaluations, sometimes schools might say there's a box basically that says they don't need any additional data for educational planning. There's pros and cons to that. So there's a variety of discussion points for that. A big one being kids grow. And we should be able to quantify that growth through measures. And if we can't, we need to kind of look at that too and change our plan. A record review for a child with severe impairments, so maybe they're They have limited to no mobility. They're having they have major medical stuff that maybe they're having frequent seizures that's constantly impairing and changing their presentation, but it's more on the medical side. I think in those cases, I don't know, talk to your school team. I think there can still be some kind of parent report measure that's standardized that can be helpful. But those are sort of the exceptions, not the rule. I think in general, we can do better than a record review. Again, it's up to each case, and you are a part of that treatment team. This decision should not be made without you. But a record review means they're going to do exactly that, review the records and not do any additional testing. So these different measures that I talked about, they wouldn't do these because they'll say the team determines they have enough information based on work samples and history that they can plan for educational programming without any additional assessments. I will say sometimes kids really struggle with testing, and we're not going to get a real clear measure of their true skills, but rather a measure of how aggravated I'm going to make them because I have to administer this test in a standardized way. I don't know. In those cases, you might want to talk about, can we break standardization? In what way can we get the information that we need without really distressing the child so much? Very rarely do I think a record review is sufficient for a variety of reasons. Kids grow, records, it might be, let's say I give a test and you get a 90 on it, and then my husband gives a test and you get a 50 on it. I can't compare that 50 to a 90 because who knows if Corey wrote a test harder or easier, if mine was harder or easier. And these standardized measures you can compare to each other across time, whereas a teacher created test, you really can't do that. It's not that they're not great, they're just not standardized, norm referenced or criterion referenced measures. The best way to get additional testing after having a record review due to the pandemic. I actually saw that Pennsylvania's Department of Ed has a list, has a website or an extra page they added about what to do with pandemic related stuff. My two thoughts would be I'd ask for it. I'd put it in writing and say I'd like testing. I'd like to formally request testing now that we are coming out of the pandemic. I look forward to talking more about that. Now, if you have an IEP, I would just call an IEP meeting and say, because remember, you could call them every day if you want, and they got to set them within a certain number of times. So I would probably just say, I'd like to call an IEP meeting to revisit the testing that we chose not to do for safety purposes. When in doubt, I'd call an IEP meeting because then they're in front of you. It's not via email or phone calls, or it's a record of exactly it. And I also think if they ever say no, because a school can say we disagree, we're not going to do it, be very clear and say, I would like it written in the minutes, or I would like it written under the parent input that I do not agree with this decision, that I as parent want ... that they're saying no to. You can actually do that at the doctors too. And you say, I want to be sure it says it in my chart that I wanted this and you're telling me no. A lot of times they'll say, oh okay, actually, I think we agree. So always make sure that your wants are documented. And I think coming after the pandemic, I would ask for it. I'd call an IEP meeting, and I would probably say I'd like to design an evaluation so that they can be sure to have the folks that need to be there to design that eval. It's a great question. So again, parental input is key. I can't say this enough. There are times that in looking through the records, I thought I had a good understanding of the child that would be in front of me. Nope. Then after talking to the parent, I got such a different picture, and I was so much more well prepared to not only help this child, but really understand his or her, how they are in the world. It's not just a set of skills, strengths and weaknesses. This is a human, and in order to help them, I have to understand them as best as I can. And so really, that information. What do they do well? Where do they often struggle? What are those patterns? What are things that make them, we call it HRE, happy, relaxed, engaged. We want our kids to be HRE as much of, not even our kids. I want that for all of you as well as myself. When we are HRE, we can engage in learning. When I am happy, relaxed, and engaged, I can engage in learning and higher level skills. and language and all of these other things. If I'm on the treadmill, please don't come in and try to teach me Russian, because I'm just trying to stay upright, oriented with oxygen to my extremities. I'm not HRE. So what are our kids' likes? What are their dislikes? What are things they do well? What are they really interested in? Where do they often struggle? And what are your goals for your child? And as soon as possible, let's ask our kids what their goals are for themselves. I know technically by the age of 14, kids need to be included. I see 3 and 4-year-olds that I'm kind of like, what do you want to work on? What's important to you? What's going awesome for you? What isn't, right? And in whatever developmentally appropriate language, let's include them. But this isn't something we do to them. Education is not something we do to children. It is something they are involved in. Therapy isn't something we do to a person. It is a process that they need to be active participants in because it's their lives. And so as much as possible, really getting that input from family. It's called social validity, but basically what's important in your family may not be in mine and might be in Benita's, right? And I'm not planning an IEP for my family. I'm planning an IEP for your child. And so that the cultural complexities and diversity, equity, and inclusion, these things all matter and need to be taken into account for a robust view of this child and your family. Okay, how are we doing on time? Okay. So these are the 13 categories that you've heard me reference. I should have grabbed my DSM. So this is what the schools can pick from, these sort of 13 options. As a medical psychologist, I've got a book of like 348 or 248 diagnoses to pick from. So that's just what they're so different. This is really about classification. Autism, ID, intellectual disability, emotional disturbance. It's called different things in different places. Sometimes it's behavior emotional disturbance, emotional disability. We have OHI, other health impairment, orthopedic impairment, speech language impairment, deafness, visual impairment, traumatic brain injury or TBI, SLD or specific learning disability, deaf blindness, and multiple disabilities. And this comes directly from IDEA. The only difference is if you are on a military installation and participating in DODEA or Department of Defense education activity, they have 11 disability categories instead of 13. 2 criteria must be met to be eligible for special education. They have to meet criteria for one of those 13 eligibility categories, and there has to be educational impact. So this happens with some frequency for specifically ASD, ED, and OHI, I see most, where in the medical realm, they meet criteria and they've got, and I wouldn't use ED, but let's say they have oppositional defiant disorder diagnosis or a trauma-related diagnosis, PTSD, or a mood disorder, depression, anxiety. But they're doing okay in school. Sometimes kids meet criteria for a diagnosis, but the district says there's no educational impact. So I think we can push back there, right? Because what is educational impact? It's not just grades, right? If they're at school white knuckling it through the day, then they come home and have, it's called after school restraint collapse. I'll say that again, after school restraint collapse, which basically means that you're using every iota of energy to get through the day only to come home and explode. That is educational impact to me, right? That is human impact. So I think we can push there. Or autism, kids are doing just fine in school, right? They're a little quirky, but they're getting good grades. So they may have that diagnosis. So sometimes you have to push or fight, explain a little bit more, get some extra data about that. What does educational impact mean? But it's important that we know, that families know, both of these criteria have to be met. Criteria for one of the 13 eligibility categories set forth by IDEA that are listed here, and educational impact, which is not the case in private practice. So I can make a diagnosis, it has to impact their life in some way, but not just school. But because school is focused on education, and in the educational setting, there's some different criteria. And so sometimes I think that there is a narrow definition of what educational success is, and it's often just grades. And I think as we expand our understanding of the importance and the skills learned in schools, that definition is expanding a bit, but things certainly do take time. Okay, you should get the evaluation report. You can get it 10 days in advance of the meeting. I do like to say there's pros and cons of getting it in advance. I've had families get it in advance and then not really be able to understand the information, not because they're not bright, but because it's written, you know, for a professional, and then it can really ramp up the anxiety. So you know you best. Some folks like to get it in advance so you can read through it so that you can have somebody explain it to you. You know you best, but you certainly can get it up to 10 days in advance. And if you don't want it 10 days in advance, you need to say that, but you know that you have to waive that right. Sometimes it's called an ER, but the evaluation report should include the results from all the different evaluations that were conducted. I do think for the first evaluation, for your initial eval, it is good to get it in advance if your anxiety can tolerate that, because so much information is covered in that results meeting that, I mean, there's times that I'm drowning in data and I don't have maybe the emotional connection of it being my child. So I think getting it early, you can you can digest it bit by bit, you can get a gist of it, you don't have to understand the whole thing through and through, but particular for those initial evals, those initial eligibility evaluations where you're probably going to have speech eval, OT eval, school psych eval, educational eval, it can feel like a lot. And if you know yourself, you're like, oh, I can't tolerate that, that's okay. It should also be reviewed at the results meeting. So not getting it early is okay, and getting it early is okay. It's really, you know you best and what's best for you. So after the evaluation, remember it's that process, no more than 60 days, either the child is found eligible for special education services, which is often called specially designed instruction, and you create the IEP, or the child is not found to meet those two criteria, right? The criteria for one of the eligibility categories and educational impact, and then the child is not found eligible and does not receive an IEP. This needs to be a team decision, period. For special or for specific learning disability, each person actually has to initial next to their agreement or disagreement with that category. So even as a psychologist, so one of the things you may find if you get the ERs early, those evaluation reports, there's not going to be a diagnosis on it, because remember, they're not diagnosing, but there's this thing called you can't predetermine, right? So the team has to make the decision in that meeting whether the child has a disability and what they need. So those reports from the professionals is going to have a lot of information, but you're not going to see a label or a diagnosis or a decision, because the team has to come to that decision together. So if you do get the report early, don't expect to see a label put on there, because they can't do that. Even as the psychologist, when I worked in the schools, if it was for autism, I had to share the information, but then wait till the team comes together, and you are a part of that team to make that decision. So it's okay to get it in advance, and it's not going to look like a medical report so when I do a report in private practice, I say diagnosis autism, diagnosis ADHD. These aren't going to look that way. Now, let's say you, well, I put it in a different way. I could have moved this slide, but here we are. So how do I know if it's quality evaluation? There should be multiple measures. It should not be like one measure to determine if it's autism. Absolutely not. Because if you think of a Venn diagram, there are symptoms that align with ASD that also align with anxiety and ADHD and ID. So one and done is not going to cut it. Our kids are too important. There needs to be observations, and they have to be across time. They can't come in and do a 1 hour observation. They need to see the child in different settings and on different days. There should be work samples, and there should be multiple clinicians involved, right? So a speech path, an OT, a BCBA, a psychologist, a teacher. There should be it should be a coming together of everybody's areas of expertise to help paint the best picture of your child, their glows, their grows, and what they may need to be as successful as possible. So what if you disagree? You're allowed. You are allowed. And you can request an IEE, or an independent educational evaluation. You need to just, well, you don't have to, you can ask for the eval. I think it's good to say why, right? That you feel they were not comprehensively evaluated. And that's kind of the language you want to use, that it wasn't a comprehensive evaluation. Could be wrong measures. So maybe they have an autism diagnosis and the measures selected were heavily loaded in language, like the WISC. You don't have to know all this, right? So if you get this evaluation report, you disagree, you can stop the meeting right there and say, I need time to digest. What I say often is, we've shared a lot of information, feeling a little overwhelmed. I need to pause and have a second meeting, and we can reschedule this meeting. You do not have to sign anything in that moment. They might try to say, oh, you should, just sign this, and I will sign my attendance sheet that I was here, but I'm not signing an IEP. I'm not signing that I agree or disagree. We just went through so much information. I know for you guys, this is just a Tuesday, but for me, this is a ton, and I need time to digest this. You are allowed to say that. You are allowed to say that. You are an important part of this team. And so saying, I need time to regroup, particularly if you're feeling yourself getting emotional, because you can have as many meetings as you want, right? And so take your data, and you can always meet with outside professionals to kind of review what was done and what might not have been done. So I don't want you to see that wrong measure, think, oh shit, now I got to learn all this. You don't, you just got to tag in people that know it. It could be that the clinician didn't have the specific skill set for the child. Maybe it was an assistant instead of the actual independently licensed professional. Maybe they did an evaluation for autism that didn't include pragmatics or missing professionals. So maybe the person that did the FBA is not a BCBA. Now, school psychologists know how to do them, but if you really disagree, you can say that. Say, I want a specialist to do this. You have that right. You put it in writing, what you want and by who. So for IEEs, you often do get to select the professional that you want to use, and you often need to make the case of why. Why do you want them? And usually it's because they've got a special training, an area of special expertise. And this is done at the district's expense. You put your request in and they need to reply. The language is generally in a timely manner, but should be around 10 days. And again, do this in writing. Email is a great way to do it because then you've got a date and time stamped. Then the outside person does their evaluation, and then the team comes back together. Evaluations occur frequently. They're not a one and done. And shouldn't be a one and done, right? It's a process, and we're always growing, and evaluation is assessing our growth and development. So it can occur every 2 years for ID or intellectual disability, and every 3 years for all others is kind of that reevaluation time frame. It is okay to say a record review is not enough, and it's also okay sometimes to say a record review is. You get to decide, but that is still part of a reeval. So every 2 to 3 years, we have to look at the reevaluation has the purpose to determine if the child still meets the criteria for specially designed instruction, so that they still meet criteria for one of those 13 categories, and there's still educational impact. And then it gives us updated data to plan for the next year, but that for the IEP. But those are the goals for those reevals. And then again, you've heard me say a bunch, is this a diagnosis? It's not. School districts cannot diagnose. And there's a lot of times that folks will get an autism classification from the district, try to access outside services, and the school would not be able to, or the family's not able to get intervention because the school is not a diagnosis. So you may still need to see an outside professional for a diagnosis. That's okay. And I really want to caution, schools should not be telling you your child has ADHD or anything like that. They really, they need to refer, you need to go and get an evaluation for that. How will you remember all this? You don't have to. So I will send this PowerPoint out. I know it's being recorded. I know the ARC has tons of information. Those procedural safeguards, it's a book that's always going to be offered to you during a meeting. I actually think it would be a great research study to see how many parents accept it, because almost nobody does. And I say, take it every time. Wallpaper your bathroom in it. That book is your rights of what you are entitled to within the district and what the district must do for you. It's got timelines. It's really an agreement between, it's a contract between the district and you about what each of you are going to do. And it's so important. Most of the districts have them online now also. And then actually Pennsylvania has some really great resources. This Pennsylvania's Parent Guide to Special Ed for School Age Children is really pretty excellent. I saw it listed on a couple, well, so Patton, I like them. I actually did some work with them. But they have some really good information, and it's written in parent-friendly language. It's easy to understand. Patton also had some process maps, which is basically like the steps that are going to happen. So if you just kind of need to see that. Rights Law, I think, is an excellent resource. It can be dense and very legal language heavy. So it's okay if that's not for you. I want to give you a couple options depending on what feels good for you. And then again, those procedural safeguards by your LEA or the school district are just really invaluable. I feel like I just bleh all this information, and I'm happy to answer any questions.
Thank you so much, Dr. Tag. I'm going to stop the recording now.
Sure.
But I want to put a poll up quickly. And while parents are filling out the poll, I'm going to ask you some questions that were loaded in the chat. All right.